Trapezius. Origin, external occipital protuberance, medial portion of the superior nuchal line of the occiput, ligamentum nuchae and spinous processes of C7 through to T12, inserts into the lateral 1/3 of the clavicle, acromion and spine of the scapula. Actions: upper fibers bilaterally extend the head and neck, laterally flex the head and neck to the same side, rotate the head and neck to the opposite side, elevate scapula, upwardly rotate scapula. Middle fibers adduct the scapula, stabilize the scapula. Lower fibers depress the scapula and upwardly rotate the scapula. Rhomboids major and minor. Origin: major, spinous processes of T12 to T5, minor, spinous processes of C7 to T1. Insertion: major, middle border of the scapula between the spine of the scapula and the inferior angle, minor, upper portion of the medial border of the scapula across the spine of the scapula. Actions: adducts, elevates and downwardly rotates the scapula. Levator scap. Originates transverse processes of vertebrae 1 to 4. Inserts medial border of the scapula between superior angle and superior portion of the spine of the scap. Actions: unilaterally elevates, downwardly rotates the scapula, laterally flexes the head and neck, rotates the head and neck to the same side, bilaterally extends the head and neck. Serratus anterior. Origin: superior 8 or 9 ribs, inserts vertebral border and inferior angle of scapula. Actions: adduction and rotates the scapula upwards, elevates ribs when scapula stabilized. Pectoralis minor. Origins: 3rd, 4th and 5th ribs, inserts medial surface of the coracoid process of the scapula. Action: depresses the scapula, abducts the scapula, downwardly rotates the scapula. With the scap fix, assists to elevate the thorax during forced inhalation. Deltoid. Originates lateral 1/3 of the clavicle, acromion and spine of the scap. Inserts deltoid tuberosity. Actions: all fibers abduct the shoulder. Anterior fibers flex the shoulder, medially rotate the shoulder, horizontally adduct the shoulder. Posterior fibers extend the shoulder, laterally rotate the shoulder, horizontally abduct the shoulder. Latissimus dorsi. Originates inferior angle of the scapula, spinous processes of the last 6 thoracic vertebrae, last 3 or 4 ribs, thoracolumbar aponeurosis and posterior iliac crest. Inserts into tubercular groove of the humerus. Actions: extend the shoulder, adduct the shoulder, medially rotate the shoulder. Teres major. Originates inferior angle and lower 1/3 of the lateral border of the scapula. Inserts crest of the lesser tubercle of the humerus. Actions: extend the shoulder, adduct the shoulder, medially rotate the shoulder. Pectoralis major. Originates medial half of the clavicle, sternum and cartilage of 1st through 6th ribs. Inserts crest of the greater tubercle of the humerus. Actions: all fibers adduct the shoulder, immediately rotate the shoulder, assist to elevate the thorax during forced inhalation with the arm fixed. Upper fibers flex the shoulder, horizontally adduct the shoulder. Lower fibers extend the shoulder. Supraspinous fossa of the scapula is the origin. Insertion: greater tubercle of the humerus. Action: adducts the shoulder, stabilizes the head of the humerus in the glenoid cavity. Infraspinatus originates infraspinous fossa of the scapula. Inserts: greater tubercle of the humerus. Actions: laterally rotate the shoulder, adduct the shoulder, stabilize the head of humerus in glenoid cavity. Teres minor origin: upper 2/3 of the lateral border of the scapula. Inserts: greater tubercle of the humerus. Actions: laterally rotates the shoulder, adducts the shoulder, stabilizes the head of the humerus in glenoid cavity. Subscapularis, subscapular fossa of the scapula. Inserts: lesser tubercle of the humerus. Actions: immediately rotates the shoulder, stabilizes the head of the humerus in the glenoid cavity. Medial pterygoid. Origin: medial surface of the lateral pterygoid plate of the sphenoid bone and tuberosity of maxilla. Inserts: medial surface of ramus of the mandible. Actions: unilaterally, laterally deviates mandible to opposite side. Bilaterally elevates and protracts the mandible. Lateral pterygoid. Origin: superior head, infratemporal surface and crest of the greater wing of the sphenoid bone. Inferior head, lateral surface of the lateral pterygoid plate of the sphenoid bone. Inserts: articular disc and capsule of the temporomandibular joint, TMJ joint. Neck of the mandible and the neck of the mandible. Actions: unilaterally, laterally deviates the mandible to opposite side. Bilaterally protracts the mandible. Rectus capitis posterior major. Origin: spinous processes of C2. Inserts: inferior nuchal line. Actions: rock and tilt head back into extension, ipsilateral rotation. Rectus capitis posterior minor. Originates tubercle of posterior arc of C1. Inserts: inferior nuchal line. Action: rock and tilt head into extension. Obliquus capitis inferior. Originates from spinous processes of C2. Inserts into the transverse processes of C1. Actions: ipsilateral rotation. Obliquus capitis superior. Originates from transverse processes of C1. Inserts between superior and inferior nuchal lines. Actions: rock and tilt head into extension and ipsilaterally flexes the head.